Hey, it's Mr. Shrum, and welcome to Nervous System Issues, Part 2, the sequel. And this is my favorite part of every lesson. As you know, what can go horribly, horribly wrong? All right, so we learned about a few nervous system issues last time, and there are several other problems relating to the nervous system that can occur. So if the previous lesson wasn't enough for you, maybe now, I don't know. But yeah, here's more stuff that can go horribly, horribly wrong. We're going to talk about multiple sclerosis or MS, tetanus, and concussions. If you're into sports, I'm sure you know about concussions. MS, multiple sclerosis, is a disease where the immune system strips away the protective coating of the nerves. And this protective coating, called myelin, aids in the process of messages being sent between the brain, spinal cord, and the rest of the body. It makes that process faster. And without myelin present to protect the nerves can become permanently damaged. And that's not good. That's a big, big no, red flag. And symptoms vary depending on which nerves are affected and the extent of the damage. So some possible symptoms are numb or weak limbs, vision impairment and pain, double vision, blurred vision, bodily pain or tingling, feelings of shock when the head is moved specific ways, dizziness, shaking, fatigue, sensitivity to heat, difficulty walking and speaking clearly. What are some of the risk factors? Being between 20 and 40 years old, that is the demographic that seems to be the most at risk for MS. Being a woman, being of European descent, living in Europe, Canada, New Zealand, Australia, or the United States. If you have a family history of MS, and specific infections and autoimmune diseases can result in MS. How can MS be treated? It cannot be cured, and treatments are used to manage symptoms and slow the progress of the disease. And treatment options include medication for pain, swelling, fatigue, plasma exchange. Plasma is removed and a replacement solution is returned to the body. Physical therapy for strengthening and stretching. Prevention. You can't prevent MS, especially since the exact causes are still unknown. Tetanus. Tetanus is a nervous system disease that causes painful muscle stiffness and can make breathing difficult. It's caused by bacteria entering wounds such as punctures, burns, compound fractures, animal bites, ear infections, and ulcers on the foot. Symptoms of tetanus include spasms, stiffness in the jaw, neck, abdomen, and other areas of the body. Trouble swallowing or breathing, fever, sweating, high blood pressure, and rapid heart rate. Some of the risk factors for tetanus. In addition to the bacteria entering the body, certain conditions are necessary for the disease to spread. And those factors include not getting regular tetanus vaccines, tetanus bacteria entering a wound, other infections present, a nail, splinter, etc. in the injury, swelling around the wound. How do you treat tetanus? It can't be cured. However, treatment can help manage symptoms. Treatment options can include cleaning out the wound to prevent spreading, medications like antitoxins, antibiotics, sedatives, vaccines, etc. And time in an ICU or intensive care unit may be necessary. Prevention. Tetanus is easily preventable through regular vaccines and booster shots beginning at 2 months of age. 2 months of age. All right, next and final issue we're going to look at today is a concussion. A concussion is a traumatic brain injury from a blow to the head or violent shaking that affects brain functioning. Symptoms for concussions include headaches, loss of consciousness, confusion, amnesia of events, dizziness, appearing dazed, ringing in the ears, nausea, vomiting, slurred speech, fatigue, sleep issues, slow response to questions, irritability, depression, personality shifts, trouble with memory or concentration, light and noise sensitivity. Risk factors for concussions include playing contact sports, especially without proper protective equipment. Even with protective equipment, concussions are pretty common. Being in a pedestrian, bicycle, or motor vehicle accident, that can definitely affect your head in a negative way. Falling and hitting your head. Being a combat soldier, you're dealing with a lot of flying projectiles sometimes, and explosives, lots of loud issues. Suffering from physical abuse. If you're being physically abused and you get a concussion, that's horrible. And if you've had previous concussions before, that makes concussions in the future more likely. Since your brain's already been injured once, it's more likely to be injured again under similar circumstances. How do you treat concussions? Okay, I don't know why this picture has a person in a hammock, but treatment for concussions include physical and mental rest, pain relievers, waiting to return to play until symptoms are gone. Preventing concussions, you can take these actions: using protective equipment during sports like hockey, football, and recreational activities, wearing a seatbelt, regular exercise to improve strength and balance for the elderly, home safety measures like good lighting, no clutter, baby gates for stairs. And that's it. So the summary, we learned about MS, tetanus, and concussions today, which are more issues that can go wrong with the nervous system. And if you have any more questions about nervous system issues, or if you're curious, I can point you to other information that you can research on your own. But until next time, see you guys later. Have a good one. Bye-bye.